Hey, what's up? Dr. Taylor, Aspire Chiropractic. I want to talk to you about an interaction, if you will, that happened in the office the other day. I got this patient come in, and she goes, we're treating her for various types of back pain. She's got an old back, and she's got the things that come along with having an old back. There's some scoliosis happening there. We got some osteophytes and some arthritis that's setting in. Again, we got some twists and turns that are happening. We've got some degeneration in the discs. We've got a bunch of things that as a chiropractor, I see every single day. Neck pain, back pain, headaches. You got 24 bones in your spine. That's in my wheelhouse. That's where I live. I had a patient ask me once, he goes, hey, how many different things that are there that go on in the spine that you can help with? This patient was a musician. He goes, well, how many notes are there? He's like, what are there, 6 notes, 8 notes? He's like, let's say there's 8. He goes, there's 8 notes. I go, okay, cool. How many different songs can you write with 8 notes? He goes, okay, that makes sense. There's 24 bones in the spine. There's more than 24 things that can go on. But anyway, I digress. Patient comes in. She goes, hey, my GP told me that they don't want you to adjust my neck. I said, okay, why? She goes, well, it could hurt me. Okay, how many patients a week does your GP adjust? Well, 0. They don't know how. Aha, okay, cool. How many spines do you think your GP puts their hands on? She's like, well, I don't know. Well, what kind of stuff does your GP help with? Oh, all kinds of stuff. Headaches, indigestion, constipation, upset stomach, diarrhea. Are you talking to your GP or you're talking Pepto-Bismol? But I digress again. Generally, literally, that's what they see. General practitioner, they see all kinds of stuff. They see a wide array of things walk into their office. And they do their best to help a wide array of things. But there's something to be said for a jack of all trades, master of none. There's a tremendous amount of education that they go through. But when it comes to the physical aspect of the application of healthcare, they're lacking. So I don't want to adjust my neck. I'm like, okay, that's fine. It is your neck. You get the final say. We'll help you with the other bones in your spine that are also still equally as jacked up. Time goes on. She comes back in. She goes, hey, I don't think I'm going to continue. Okay. Why? What's going on? My GP says that I should have a DO manipulate me instead. Okay. Why? Well, because they're a DO. Okay, what does that have to do with it? Well, they're trained in manipulation. True. What's the difference? I would contend that the difference is that they manipulate less people than I do. Again, 24 bones in the spine, people come in here and I help more people with those 24 bones in a day than a DO does in a month, than a GP does in, maybe a lifetime, depending on the GP. So, long story less long, let's talk about the differences here. Because we've got, what are these people? These are all specialists. We have our own specialties, okay? There's things that they can do that I can't do. There's things that I can do that they can't do. So we've got our MDs, okay? This will include our general practitioners, our family doctors. Then we've got our DOs. What is DO? DO stands for Doctor of Osteopathy. Initially, used to be separate and distinct. Now the border here is muddied. And then we've got the DC, the Doctor of Chiropractic. So, one of the main differences here is the ability to prescribe medication. MDs, yes. DOs, yes. DCs, no. And I'm okay with that. I don't want to prescribe medication. There's a lot of responsibility in doing this. There's a lot of knowledge that needs to be had. I don't have that knowledge. I don't have that training. But one of the things we need to do here is if someone's prescribing these things, they need to know if you're already on another medication and what that interaction will look like. Because I still am concerned with what the patient is taking. I have no say in how they're taking it, why they're taking it, or anything like that. But if somebody comes in and they go, hey, here's my list of medication, and it's 5, 10, 15, 20 items long, My first concern is, do they know, the prescribing doctor, this list? And beyond that, do they know the interactions among the items on that list? So I'll tell you right now, you get more than 5 prescriptions in your body on a regular basis, there is a 99% chance that there's going to be an interaction. Is it going to be an adverse interaction? I don't know. Not my training, not my expertise. But I do know, through studies and research, there's a 99% chance if you got more than 5, those drugs are interacting. Let's hope it's not an adverse one. Next one. We've got surgery. MDs. Absolutely. DOs, if they so choose. DCs, no. I'm not cutting you open. I don't want to do that. There's DCs that'll wear scrubs. I don't understand that. Scrubs are for if you're going to get bodily fluids on you. If you're a chiropractor and you're getting bodily fluids on you, I think you might be doing it wrong. But don't come to me for surgery. Now, I have certainly sent people out, come to me with an issue in a neck, in a spine, heck, in an arm, and an AC. Doc, I've got knee pain. Okay, do a couple orthopedic tests because we're still trained in the same type of orthopedics as these. It's like, man, these tests are kind of lead me to think you have a torn ACL. Let's send you for an MRI. We send you for an MRI, even as a chiropractor. They come back, hey, there's no ACL. Guess what we're doing? We're going to send you to one of these guys because they're going to fix that torn ACL. So, as a chiropractor, can I prescribe? No. Do I want to? No. As a chiropractor, can I do surgery? No. Do I want to? Yeah, kind of sometimes. I think orthopedic surgery would be fun. It's literally just hammers and saws and chisels. It's woodworking, but instead of wood, it's bone. That sounds kind of cool. Lastly, the adjustment. Can MDs adjust? They can. Did you know that? Can DOs adjust? Yes, they can. They call it manipulate. Can DCs adjust? The good ones can. What's the difference then? If literally this is the only thing on this map here that a chiropractor can do, why would you even go to a chiropractor? An MD can adjust. I don't know if they're really trained on it. A DO can adjust. They actually take training in manipulation of joints. Chiropractor, obviously, that's what we do 100% of the times, the good ones anyway. Why go here? Because the chiropractor is trained in the adjustment. Like, I can't put enough check marks here. Again, what do I do in a day as far as an adjustment is concerned? More than this person does in a month, more than this person might do in a career. The 24 bones in that spine are where I live. There is nobody that'll see more and know more about those 24 joints and how to help them safely, effectively, and naturally than a well-trained chiropractor. A DO can adjust. The DO is a wonderful middle ground, if you will, between the MD in Western medicine and the complementary medicine of the chiropractor. They do have training in manipulation of the spine and of the joints. MDs, they might, but again, you come in, doc, we're going to take just a stupid, simple example. I have a crick in my neck. You got a crick in your neck, got a brain up top here, spinal cord comes down, C1, C2, C3, let's say C2 is jacked up. This thing needs to move, and it has an intimate relationship with the nerves that come out of the top of your neck, go into your head, and your brain stem, your brain and your spinal cord. This bone needs to be moved. You want it to be moved without surgery, and there's not a pill in the world that'll move a bone, so it's got to be done physically. We got to move this bone. Who do you want to move it? Do you want the one that doesn't move it, has little to no training, and literally zero daily experience? Do you want the one that has training? Yay. But in the grand scheme of things, it's not something they do every day. Or if you want a safe, natural, physical remedy, sometimes just immediate results of that second bone in your neck to move, so you can come in, get adjusted, and leave? Do you want the person who has literally dedicated their life and their career to it to do it? Completely non-biased. So, my GP told me that they want me to have a DO manipulate my spine. Cool. Go for it. Come back after you realize it doesn't work as well. There are differences. There are distinct differences. There are specialties. I can't prescribe anything. I can't perform surgery. I work on 24 bones in the spine, but I guarantee you, I do it as good or better than anybody. If you want a safe, effective, natural remedy to neck pain, back pain, headaches, and something that literally gets the body working more efficiently, functioning better, go to a chiropractor. You want it done really well, go to this chiropractor. But again, I'm biased. You ever have anything that you want me to help you with, you walk through that door, you give us a call. We're ready to help you when you're ready to be your best. Naturally. And don't worry, MDs and DOs, we've got them coming to see the chiropractor too. You guys have a great rest of your day.